Hello, and welcome to the 2021 Benefits Summary for the BlueCross and BlueShield Service Benefit Plan, also known as the BlueCross and BlueShield Federal Employee Program, or simply FEP. Thank you for taking a moment to learn more about us and our updates for 2021. Today, we'll go over the basics: our benefit plans, what's new, pharmacy benefits, and wellness programs and tools. This is our 60th year participating in the Federal Employees Health Benefits Program, or FEHB. We're thankful to the U.S. Office of Personnel Management for partnering with us. We're also thankful to all of our members for trusting us all of these years. For 60 years, we've been proud to be the #1 healthcare provider for federal employees. And we're proud that over 99% of our members choose to stay with us year after year. During these uncertain times, we're working to make your healthcare experience as easy as possible so you can focus on your family's well-being. Now, more than ever, your coverage shouldn't be something you have to worry about. We know many of you have serious concerns and questions regarding COVID-19, also known as the coronavirus, especially as it continues to significantly impact our daily lives. We remain committed to ensuring you can access the care you need throughout the COVID-19 pandemic. While this presentation will discuss 2021 benefits, we do want to take a brief moment to remind you that we continue to extend special coverage for COVID-19. You can stay up to date on our ongoing commitment to members during this time at fepblue.org/coronavirus. Now, let's go over the basics of our coverage. We have 3 plans for every need and budget: Standard Option, Basic Option, and FEP Blue Focus. All 3 of these plans have access to a wealth of healthy benefits, like free preventive care, referral-free care from specialists, worldwide coverage, and wellness rewards and discounts. Each of these 3 plans do offer unique benefits. We'll go over those in a little bit. Also, please take note of the icons for each of our 3 plans. We'll use them throughout this presentation to show you which benefits apply to which plans. When you enroll in the Service Benefit Plan, you can choose to cover yourself with self only, yourself and one family member with self plus one, or you and multiple family members with self and family. Let's move on to our network. With a large nationwide network of doctors and hospitals, in-network care is never far away. Our network includes over 96% of hospitals, 95% of doctors, and 60,000 retail pharmacies in the U.S. Plus, members of all 3 of our plans have access to the same network. With so many preferred providers in our network, where do you start? There are 3 simple ways to find a provider: online at provider.fepblue.org, via our FEP Blue mobile app, or by calling the number on your member ID card. You can find a provider using whichever method works best for you. When we say preferred providers, we simply mean providers that are in our network. Going to these providers means that you usually pay less out of pocket and you will not need to submit a claim for your care. Routine preventive care is one of the best things you can do for your health. When you visit a preferred provider, many preventive care services come at no cost to you. Some examples of covered preventive services are an annual physical, blood pressure screenings, cholesterol screenings, well child visits, diabetes screenings, flu shots, shingles vaccinations, cancer screenings, and more. These are just some examples. You can see a full list of what's covered in our benefit brochures, which are available to download on our website, fepblue.org. The doctor's office isn't the only place to get care. With telehealth services provided by Teladoc, you can get care anywhere. Using your phone or computer, you can chat with a board-certified doctor 24/7. You can also use your telehealth benefit for behavioral health consultations, dermatology services, and nutritional counseling. Starting in 2021, we're also covering telemedicine services offered by doctors outside of the Teladoc network. If you visit a non-Teladoc provider over the phone or by video, you will pay your regular cost share based on the service you're receiving. We'll discuss more of what's new in 2021 shortly. Next, we'll talk about the specifics of each of our benefit plans. Each of our plans offers something for every need and budget. Here's a quick breakdown of what each of our plans offer. Now let's go into more detail. Here's a breakdown of deductibles based on plan and level of coverage. Deductibles are what you pay before we cover our share of the cost. Remember that deductibles only apply to certain services. You'll notice that both Standard Option and FEP Blue Focus have a deductible. Basic Option does not. Here are the out-of-pocket maximums when seeing preferred providers for each plan and level of coverage. Out-of-pocket maximums are the most you would pay out-of-pocket annually before we cover 100% of all your covered medical costs. This includes coinsurance, copays, and deductibles. Here are our 2021 premiums for Standard Option. Note that these premiums do not apply to all enrollees. If you are in a special enrollment category, contact the agency or tribal employer that maintains your health benefits enrollment. Here are our 2021 premiums for Basic Option. Here are our 2021 premiums for FEP Blue Focus. With the Service Benefit Plan, it's affordable to get the care you need. The next few slides will provide a breakdown of what you'll pay for common services when visiting preferred providers. It's important to remember that if you have Medicare primary or receive care overseas, these costs may be different. Let's go over some highlights. All three plans have low copays for primary care and specialist visits. With FEP Blue Focus, you'll notice that you pay $10 per visit for up to 10 primary or specialty care visits. That's per member on your contract. You'll also notice that all three of our plans cover your first 2 teledoc visits and all nutritional counseling visits at no out-of-pocket cost to you. After your first 2 visits, you'll pay a $10 copay if you're a Standard Option or FEP Blue Focus member and a $15 copay if you're a Basic Option member. If you're pregnant or planning a pregnancy, you'll also want to take a moment to look at our maternity benefits. Here's what you pay out-of-pocket for hospital stays, surgery, and visits to the emergency room. Let's take a moment to call out one of the key distinguishers of our plans. You'll notice that both Standard Option and FEP Blue Focus are a mixture of coinsurance amounts and copayment or copay amounts, while Basic Option is primarily copays. A coinsurance is a percentage you'll pay for a service, usually after you meet your deductible amount for the year. So you'll see that after you meet your deductible, you have a coinsurance to pay under Standard Option and FEP Blue Focus for outpatient hospital services, surgery, and medical emergency services in an ER. A copay is a set amount you'll pay for a service. It doesn't matter what our allowance is. So for Basic Option, you'll pay a set amount for these services rather than a percentage. And lastly, here's what you might pay for lab work, diagnostic services, and chiropractic care. Next, let's talk about what's being changed and updated for 2021. Let's begin with telemedicine. During these uncertain times, you may prefer to get care at home rather than going into the doctor's office. Telemedicine makes it easier than ever to get care for minor illnesses and injuries, wherever and whenever you feel comfortable. Starting in 2021, we're covering online or phone telemedicine visits you receive from your primary care providers or specialists who are outside of the contracted Teladoc network. You pay your standard primary care and specialist copays for most non-Teladoc telemedicine visits. Also for 2021, we're providing preventive care benefits for bowel preparation medications associated with colon cancer screenings and certain HIV medications. The hypertension management program will be limited to the contract holder and spouse on your contract, 18 and older. If you're a Standard or Basic Option member, you must complete the Blue Health Assessment, or BHA, to receive a free blood pressure monitor. All chest x-rays will now be covered under your regular medical benefits. Previously, we covered 1 per calendar year for adults as part of your preventive benefits. We made changes to our approved drug lists, also known as formularies. You can download the updated drug lists at fepblue.org/what's new. Now let's talk about changes to our standard and basic option plans. We increased the out-of-pocket cost for Tier 4 and 5 specialty drugs. We increased the basic option copay for emergency room care to $175. Previously, it was $125. And we provide benefits for hearing aids up to $2,500 every 5 years. Previously, we provided benefits every 3 years. We've made some changes just for FEP Blue Focus, too. For 2021, we will provide benefits for continuous home hospice care at no out-of-pocket cost to you. Previously, you paid 30% of our allowance. We increased the out-of-pocket catastrophic maximum to $7,500 for self-only and to $15,000 for self-plus-one and self and family contracts. Previously, it was $6,500 for self-only and $13,000 for self-plus-one and self and family. Keep in mind, these are just some examples of the changes we've made for 2021. To see the full list, download our brochures at fepblue.org/brochure. Next, let's go over our pharmacy benefits. We have 3 pharmacy programs designed to get you the prescriptions you need: the Retail Pharmacy Program, Mail Service Pharmacy Program, and Specialty Pharmacy Program. You'll see that both the Retail and Specialty Pharmacy Program are open to all of our members. However, the Mail Service Pharmacy Program is only available to Standard Option members. It's also available to Basic Option members with Medicare Part B Primary. A formulary is a list of covered drugs that is organized into different tiers. It includes generic, brand name, and specialty drugs, as well as preferred drugs that will lower your out-of-pocket costs. In general, the lower the tier, the more cost-effective the drug. Each of our 3 plans has its own formulary. We'll go through what each tier is together. If you want to see the full formularies, visit fepblue.org/pharmacy. Standard and Basic Option have 5 drug tiers. These tiers are separated by whether they're generic, brand name, preferred, or non-preferred. Tier 1 drugs are generic drugs. These are the most cost-efficient drugs you can get. They are as effective and safe as their brand name counterparts. Tier 2 drugs are preferred brand name drugs. These are brand name drugs that are cheaper and just as safe and effective as non-preferred brand name drugs. Tier 3 drugs are non-preferred brand name drugs. These drugs are safe and effective but have a high cost because there is a generic or a preferred brand name drug available. Tier 4 drugs are preferred specialty drugs. Specialty drugs are used to treat complex conditions and may have special shipping and storage instructions. Preferred specialty drugs are cheaper than their non-preferred alternatives. Last, Tier 5 drugs are non-preferred specialty drugs. These are used to treat complex conditions but cost more since there is a preferred specialty drug available. Here are the drug tiers for FEP Blue Focus members. There are only 2 tiers. Tier 1 drugs are preferred generics, and Tier 2 drugs include preferred brand name, preferred generic specialty, and preferred brand name specialty drugs. All Service Benefit Plan members can access our Retail Pharmacy Program, which includes over 60,000 preferred pharmacies nationwide. Basic Option and FEP Blue Focus members must visit preferred retail pharmacies to receive coverage for drugs. To fill a prescription at one of our preferred retail pharmacies, simply show your member ID card when submitting your prescription. Standard Option members may purchase drugs from non-preferred pharmacies. The pharmacy will ask you to pay the full amount for these items, and then you will need to file a claim with us for reimbursement. These are the cost shares for each tier of drug in our preferred retail pharmacy program for Standard and Basic Option members. This is for a 30-day supply. These are the cost shares for FEP Blue Focus members using our preferred retail pharmacy program. This is for a 30-day supply. The Mail Service Pharmacy Program is a convenient and cost-effective way to get your maintenance or long-term drugs. This program is intended to be used for drugs you need to take regularly and long-term. This might include drugs for high blood pressure, arthritis, or other chronic conditions. For one copayment, you can get up to a 90-day supply of your drugs. With the Mail Service Pharmacy Program, you also get access to a registered pharmacist, available 24/7. This program is available to all Standard Option members and Basic Option members with Medicare Part B Primary. Here are the cost shares for Standard and Basic Option members using the Mail Service Pharmacy Program. The specialty pharmacy is another one of our pharmacy programs. Specialty pharmacies fill prescriptions for complex medical conditions such as hepatitis C, multiple sclerosis, and hemophilia. Medicines handled by a specialty pharmacy include oral, inhaled, injected, and infused drugs. These drugs often require complex care, a high level of support, and specific guidelines for shipment and storage. In addition to specialty drugs, the Specialty Drug Pharmacy Program will provide members with personalized pharmacy care management services, including access to an on-call pharmacist, coordination of care with your doctor, and more. Here are the cost shares for Standard and Basic Option members using the Specialty Pharmacy Program for up to a 30-day supply. Here are the cost shares for FEP Blue Focus members using the Specialty Pharmacy Program for up to a 30-day supply. We encourage you to learn more about these programs at fepblue.org/pharmacy. We want to make it easy for you to know the cost of your drugs before you pick them up. The Prescription Drug Cost tool lets you check drug costs and see if it's covered under your plan. It'll even show you lower cost options if they're available. If you're not a member yet or looking to switch plans, this tool also lets you compare the costs across all 3 of our plans. Get started with the Prescription Drug Cost tool at fepblue.org/rx. Next, let's talk about our wellness programs and tools. The best way to take full advantage of all our benefits, wellness programs, and tools is to stay up to date with your coverage. First, be sure to download the FEP Blue app, which is available for free on the App Store and Google Play. Second, check our site, fepblue.org, regularly. There you'll find all our important announcements and your full benefit information. Third, sign up for our Blue News emails at fepblue.org/news. You'll get helpful updates, wellness tips, and more delivered straight to your inbox. Fourth, follow us on Facebook, Twitter, LinkedIn, Instagram, and Pinterest at FEP Blue. You'll also want to make sure to register for MyBlue. MyBlue is our secure, member-only site that helps you get more out of your service benefit plan coverage. It gives you access to exclusive tools and resources, like a financial dashboard, a 24/7 nurse line, and wellness incentives. You'll also need a MyBlue account to access most of the FEP Blue app's features. The best part is it's free to sign up. To sign up, visit fepblue.org/signup. Call 1-800-411-BLUE and select the prompt for assistance setting up a MyBlue account. A rep will provide you with a unique PIN. Then, complete the registration field and log in with your new credentials. Now let's talk about the incentive programs themselves. We'll start with our program exclusively for FEP Blue Focus members, the Routine Annual Physical Incentive Program. Routine physicals are the key to having good overall health. FEP Blue Focus members can earn rewards for simply having their annual physical. Let's walk through those rewards together. You can receive a 4-month, no-cost gym membership through Fitness Your Way by Tivity Health. This is valid at more than 10,000 health clubs across the country. You can get a personalized diet and exercise plan by sending a cheek swab to Molecular Fitness. You can get 2 weeks of organic, healthy meal kits delivered straight to your door with Sunbasket. That includes 3 meals each week for 2 people. Or choose from one of several Fitbit devices, such as the Fitbit Charge 4, Inspire 2, Aria Air, and Aria 3. You can also get access to a Fitbit Premium account. Now let's transition to the Wellness Incentive Program offered to Standard and Basic Option members. When it comes to good health, it pays to have a plan. The Blue Health Assessment can help. The BHA is an online questionnaire that gives you a personalized action plan to help you reach your goals. All you need to do is answer some simple questions about your health, receive your health score and personalized plan, and discuss it with your doctor. Standard and Basic Option members can earn $50 the first time they complete the BHA in 2021. FEP Blue Focus members can take the BHA to receive a personalized action plan, but are not eligible to earn rewards. All members need a MyBlue account to participate in the BHA. If the Blue Health Assessment gives you a plan for better health, the online health coach helps you along the way. The online health coach encourages you to complete healthy activities each day to reach your health goals. Standard and Basic Option members can earn $40 for each eligible goal they complete, up to 3, for a total of $120. No matter what your goals are, the online health coach can help you get there. You can earn rewards for reducing stress, losing weight, exercising more, feeling happier, or eating better. The online health coach can also help you manage chronic conditions and earn rewards for it, including asthma, heart disease, heart failure, hypertension, and COPD. Service Benefit Plan members have access to more incentives that help you stay healthy. We'll go through them together. With the Pregnancy Care Incentive Program, pregnant Standard and Basic Option members can earn $75 and a pregnancy care box to provide ongoing prenatal care. This pregnancy care box includes books for you and your baby, clothing items for your baby, discounts on name brand products, and more. Members who are pregnant or nursing can also receive a free Almeida breast pump kit and milk storage bags. For members who have diabetes, it's important to keep your blood sugar levels under control. Standard and Basic Option members who are managing diabetes may be able to earn $100 for keeping their A1C levels within a healthy range. Also, Standard and Basic Option members with diabetes who are looking for ongoing support can participate in the Diabetes Management Program by Livongo. This program provides you with one-on-one coaching, plus you'll get a free digital glucose meter. We're committed to helping you get the prescriptions you need without breaking the bank. The discount drug program gives members up to a 24% discount on drugs not covered by our plan. Your cost will be the lower of either the discount price offered through this program or the pharmacy's regular retail price, meaning you can get the lowest price in that pharmacy at the time you buy the drug. Last, with our Medicare reimbursement account, Basic Option members with Medicare Parts A and B can get reimbursed up to $800 per year if they pay Medicare Part B premiums. Rewards Standard and Basic Option members earn for the BHA, Online Health Coach, Diabetes Management Incentive Program, and/or Pregnancy Care Incentive Program are loaded onto your MyBlue Wellness Card. The MyBlue Wellness Card is a debit card that you can use to pay for qualified medical expenses. Qualified medical expenses are a pre-approved list of medical-related costs. As you complete incentives, we'll automatically add funds to your existing card. These funds do not expire as long as you're a member. You can use these funds for qualified medical expenses. Some examples include prescription drugs, doctor's office co-pays, acupuncture, and lab fees. All Service Benefit Plan members also have many additional wellness programs designed to help them improve their well-being. If you're looking to quit smoking or using e-cigarettes, our Tobacco Cessation Incentive Program can help. We'll give you free tobacco cessation drugs, tools, and resources to help you quit for good. Members with high blood pressure know how important it is to regularly check your numbers. With the Hypertension Management Program, you'll get a no-cost blood pressure monitor to track your numbers at home. You're eligible to receive a new blood pressure monitor every 2 years. Our care management programs are here for members with long-term, complex, or life-threatening illnesses. When you enroll in the program, you'll work with a local healthcare professional who knows your benefits and a care manager to help you identify resources that can help you manage your condition. Staying active is a great way to improve your health and make you feel better. As a Service Benefit Plan member, You get access to discounts at over 10,000 health clubs across the country. Plus, there are no restrictions on which locations you can use and how often you go. If you're looking for health advice, where to go for care, or tips for healthy living, you can call our nurse line 24 hours a day, 7 days a week. With an average of 15 years' experience in patient care, our registered nurses can be your first step to feeling better. To speak with a nurse, you can call 1-888-258-3432 or via the FEP Blue app or MyBlue. Blue 365 is a free discount program only available to BlueCross and BlueShield members. You get access to exclusive health and wellness deals ranging from healthy eating, apparel, gym memberships, and so much more. These deals are handpicked from brands you love and are always being added. And best of all, there's no limit to how many you can redeem. Be sure to sign up to receive emails from Blue 365 so the discounts get sent to your inbox. Check back often so you never miss a deal. Blue 365 provides access to some of the industry's best discounts, including low-cost gym memberships through Fitness Your Way, Fitbit wearable devices, gym shoes and athletic apparel, including Reebok and Skechers, and dental products, including Sonicare toothbrush subscriptions. Blue 365 also includes deals on hearing aids, dieting and healthy eating, family travel, personal care, financial health, pet insurance, and more. Explore all the deals at fepblue.org/blue365. Service Benefit Plan members have access to helpful tools and resources that help you get even more out of your coverage. One way is avoiding surprise costs. With our Procedure Costs Estimates tool, you can search for certain treatments and get average estimates for how much you'll owe. We're always updating our estimates so the tool has the most accurate information. Your financial health is part of your overall health. The financial dashboard gives you an easy-to-understand summary of your healthcare financial data, including your deductible and claim amounts, so you can better understand your spending. We also want to help you see the bigger picture for your health. Your personal health record makes it easy for you to keep track of your medical history via your MyBlue account. It gathers your health data from your claims, Blue Health Assessment, and your personal entries in one secure place. It's not always easy to pick a health plan for you and your family. The AskBlue FEP Medical Plan Finder tool is here to help. All you need to do is answer a series of questions, and it'll automatically recommend a plan based on your needs. AskBlue will also provide you with personalized instructions on how to enroll after completing the questions. Try it today at askblue.fepblue.org. Our new FEP Healthcare Cost Advisor is another way the Service Benefit Plan can help your financial health. If you've been enrolled with the Service Benefit Plan for at least 1 calendar year, the FEP Healthcare Cost Advisor can show you how much you've paid out of pocket for the prior year. This information can help you understand your healthcare spending. You can choose to use a self-guided experience or chat with a virtual health advisor. This has been a summary of the Service Benefit Plan benefits. To get an official statement of benefits for your plan, you can download both the Standard and Basic Option and FEP Blue Focus brochures at fepblue.org/brochure. Our website, fepblue.org, is the best way to access any information you need. We've recently redesigned it to make it easier to use. Plus, we've added some new features. Visit fepblue.org to see what's new. Be sure to download the FEP Blue app to keep up with your benefits on the go. With it, you can keep track of out-of-pocket costs, find preferred providers in your area, use your digital member ID card, access our 24/7 nurse line and telehealth services from Teladoc, receive important messages, and explore our benefits with our interactive benefits tool. You can download the app for free on the App Store and Google Play. If you have any questions, you can call our National Information Center, which is available weekdays from 8 a.m. to 8 p.m. Eastern Time. You can easily stay connected with the latest Service Benefit Plan news and updates by following us at FEP Blue and signing up for our Blue News newsletter at fepblue.org/news. Thank you for taking a moment to learn more about the Blue Cross and Blue Shield Service Benefit Plan.